Thank you, Governor. Good afternoon. As was posted on the data dashboard on the Rhode Island Department of Health's website, we unfortunately have a number of additional fatalities to report. Our number of fatalities was previously 105. With the 13 additional fatalities we are confirming today, we now have 118 total fatalities. We express our condolences to all of the families who are directly impacted. Of the people who have passed away, one person was in their 50s, 2 people were in their 60s, 7 were in their 70s, 1 person was in their 80s, 1 person was in their 90s, and 1 was more than 100 years old. 10 of these people lived in congregate care settings. 9 of these fatalities occurred yesterday. The other 4 fatalities occurred in the days leading up to yesterday. Like states across the country, Rhode Island is facing extremely difficult challenges in our nursing homes. Every day, you hear the evidence of this as the number of positive cases continues to grow, as well as the number of unfortunate deaths. I said that we would take some time today to share with you the most aggressive, comprehensive approaches that we're taking together with the nursing home community to do the best we can to support the residents and staff and administrators. I want to assure residents of our nursing homes and other congregate settings across Rhode Island, as well as their families, that the state is doing everything we can to keep residents in these and other congregate settings safe. We are doing this by working cooperatively with our nursing home administrators, as well as the dedicated staff, not only to ensure the safety and care of residents, but also to support the professionals who have dedicated their careers to caring for this vulnerable population. I want to start with evidence of the measures that we have been taking up until now. And then I'll go into what we're doing from now going forward, so you have a sense of the picture, a snapshot of the types of measures being taken. From the start of the crisis, we have focused our efforts on several key strategies, beginning with preventing the spread by prohibiting visitors to nursing homes, as well as isolating individuals at the first sign of symptoms and quarantining their close contacts. Due to our connection with what other states were learning and also assessing the research, we had an understanding early on that symptoms can be very atypical in this community. You can sometimes have situations in our seniors where symptoms may not be present, or they may be very mild or different from what you would usually expect. We've worked closely with nursing homes to have a very low threshold for concern based on symptoms or any changes connected to a resident, so that we can be aggressive in determining when there was a potential for COVID-19 that needed to be assessed, when the residents needed to be isolated, and the appropriate quarantining of the contacts as well as the staff. We've also taken aggressive steps in terms of testing, which has been critical to meeting the nursing home's challenges. We've gone beyond what the usual approach is with testing because of the congregate care setting. We've addressed testing for the employees of the congregate care facilities, knowing that that is just as critical to help us understand how to best care for the residents. That way, we have been able to cohort staff who may have been exposed to COVID-19 but are now symptom-free and could work. Those were best to continue to care for residents who are COVID-19, who have COVID-19 in the nursing homes versus staff who have not been exposed. I've also shared the approach of really limiting how many staff persons enter a resident's room. We've also had discussions across all the nursing homes of really understanding where staff members are working in terms of their facilities. So if there is one facility that there's been concern of a case or a person who has been identified as having COVID-19, in assessment of all of the staff in that facility, we've also looked to determine which other facilities does the staff person work at, so that we can look aggressively at how to implement infection control practices at those additional facilities as well. Along those lines with testing, we now have established a fast lane for testing of healthcare workers from nursing homes through the CVS test site at Twin River. Currently, there are 200 dedicated spots per day specifically for the healthcare workers and staff who are working in congregate care settings, so that we can continue to assess what the exposure is and be able to assign the appropriate staff to the appropriate residents when possible. We realized early on that we needed to supplement our workforce and eliminate any barriers to doing so as quickly as possible. To date, we have licensed an additional 960 healthcare workers to be able to provide support in these congregate settings. Mechanisms that we have taken to accelerate this process include fast-tracking licensing for out-of-state professionals who are here in Rhode Island and can now join the workforce quickly and effectively. We've waived the training requirements for certified nurse assistants whose licenses may have lapsed within the last 2 years, so that they could also accelerate their ability to join the workforce. We've moved nursing students into the workforce quicker by issuing temporary nursing assistant licenses for those who have completed at least 1 semester of nursing school and could begin engaging in the work settings with the appropriate supports. We've accelerated training programs for those individuals who want to be certified nurse assistants so that they can gain the training they need in a fraction of the time usually required and then begin to join the workforce with the appropriate supports as well. And we've also created robust outreach efforts to newly licensed healthcare workers to be able to help support what's needed in the nursing home settings. Now I want to spend a few minutes about where we are now and what we are looking to do going forward. Moving forward, we're looking to develop strike teams to enhance what we have already implemented and to further support the nursing homes currently. These strike teams will coordinate the efforts I have mentioned and be able to expedite a process where we can strategically provide what's needed for nursing homes that are experiencing a variety of challenges. This will include providing on-site testing at nursing homes where there are outbreaks so that there can be a rapid turnaround in the results and changes made as needed. That testing would be available both for residents as well as for staff. We would also be able to ensure a continued focus on infection control measures taken as aggressively as possible, assure appropriate personal protective equipment that's needed for nursing homes, particularly those with clusters of cases, and assess the quarantine and isolation protocols in the priority congregate care settings that need to implement them most effectively. From a testing strategy perspective, We are also implementing a cyclical testing program for all nursing homes so that staff and residents, where appropriate, can be tested continually every 7 to 10 days. The reason this is important is because we have a specified area as a congregate setting where we can work closely with that entity to understand the best interpretation of those test results. We always talk about the fact that testing is reserved for people who have symptoms for us to get the most accurate results. In this congregate care setting, it's the unique time where we can use testing strategically in cooperation with the nursing home to better understand that point in time. It's really helpful for when there is a positive result. It's less helpful for when there is a negative, because particularly if we are completing the test on someone who does not have symptoms, it is not as reliable to just disregard any concern for COVID-19 if a negative test occurs. But it's extremely helpful when we can have a positive result and be able to respond to that in terms of the cohorting and the other aggressive infection control measures that we're taking. Knowing that this testing result gives us that one point in time, we're looking to be aggressive into having a cyclical approach so that we can repeat the tests on a regular basis and continue to assess across the nursing home community what the risk is and make updates to the changes that need to be made. This will involve delivering swabs to nursing homes and picking up samples the next day, as well as having a mobile testing unit available for places where there are clusters of cases where we can deploy them to the appropriate hotspots as needed. In addition to COVID-positive nursing homes that I discussed yesterday, quarantine sites can provide a cohorting alternative to containing virus spread. And they're critical to our hospital system's ability to decompress so that we can serve more patients through the surge. So we're also looking to have facilities where we can accept patients as they're being discharged from the hospital so that they're no longer in the acute care setting, but can be monitored in a safe and appropriate quarantined setting before returning to a nursing home so that we can minimize the number of patients who may have COVID-19 back to a nursing home. We're also working to augment the workforce where shortages exist today and to create a sustainable pipeline of workers. To do this, we're looking at an array of options that include developing a facility staffing portal to manage critical resources across the congregate care setting environment. We also know we need to focus on what else we can be doing in the community to support those leaving hospitals, including providing supports to families who are caring for their loved ones who are seniors at home as well. So it's important for us, as we are taking into account this comprehensive approach, to make sure that we are aligning it with the needs of the community, the living conditions that are there, and engaging with the family members who are handling this so that we can provide the support needed. I really want to thank our nursing homes and the dedicated professionals who care for our fellow Rhode Islanders. In addition to what I've discussed, you can know that there is an entire state of people who are behind you to help support us during this challenging time. Finally, I want to echo the governor's appreciation to hospitals and hospital leadership. We have already sent out the guidance that the governor referenced for how we would prepare if we needed to for limited supplies. We often refer to that as having a crisis standards of care. Hospitals have put tremendous amount of work into that. We've provided guidance so that we can have a statewide, consistent approach to how we would need to engage, if we needed to implement safe and equitable approaches to providing care to those who are in need if resources were to be limited. I want to credit the hospitals, as I've mentioned. I want to say thank you to the Hospital Association of Rhode Island in supporting us in developing this, as well as the ethicists and clinicians through Brown that has helped us in pulling this together so that all Rhode Islanders can know there is a thoughtful approach that is in place and will be ready, meeting standards across the state consistently in how we would be able to care for people in need if limited resources were to occur. I'll finish with thanking the governor. Because of her thoughtfulness and leadership and the teams that are in place, we're hopeful that it is less likely we will ever need to activate those types of crisis standards of care. But if we were to, you can know that we will be ready as a state.